Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. It's March 27, 2022. COVID update, amongst other things. I haven't done one in a while because I think COVID, like I said last time, is really something we need to de-emphasize. I'll start doing more posts about general things now. But the update on COVID is cases are down about 33%, or about 29,000 cases a day in the United States. But keeping in mind, every person who gets anything gets tested for COVID. So it's sort of disproportionate numbers, because if you test every single person with congestion, cough, cold, or whatever, you're going to have higher numbers. The numbers of people dying have gone down. Again, though, when we look at that stuff, it's people who are old, people who are fat. Sorry, it's a nice way of saying it, obesity, but let's just call it like it is. If you're a big fat old person, you got problems. If you get COVID every now and then, I'm sorry. Now, occasionally it's going to happen to someone else, but it's the truth. You look at the Israeli data and this baloney about a fourth booster shot. I mean, there was a 78% reduction in death in people over the age of 80. I don't, and there's no data for anyone under 60, and the data for under 60 was marginal. They don't talk about any complications or anything else. So again, when they're talking about doing a booster, and they're trying to, Pfizer and Moderna are fighting so hard to get that passed, approved. If you were ever going to consider it, which I would strongly discourage you from, the answer would be only if you are very old. And the thing is, if you're immunocompromised, you get an EV shield vaccine, or not a vaccine, or antibody infusion, and you can just do that every 3 months. So again, that's the right way to approach it. I don't think doing the booster makes any sense at all, but that's my opinion. Yeah, and it's not, I'm not breaking FDA guidelines, because FDA guidelines aren't for a fourth shot. So, and they won't release their data on were boosters effective for people under 50, and they won't release the data of childhood vaccination. Was it even vaguely effective? But I think we can probably surmise that if 1 in 100,000 kids got hospitalized with COVID, and there's about a 1 in 7,000 chance for a heart event with COVID requiring hospitalization, that those are upside down numbers for that, now that we're starting to see more data. So the summary is the Omicron variant has moved on to a subvariant, which is, I think, B3. Noted virologist at NYU said that if you've been prior infected with Delta or Omicron, don't even worry about it. Your chances of getting infected are well less than 1%. Again, that's his words, not mine. Prior infection does matter. The antibody rate in some reports are as high as 95% in the population. And again, the boosters are not for Omicron, they are for original. And it's the same thing. Pfizer and Moderna have to get rid of the vaccine they've made, so let's keep on giving one that doesn't match. So boosting people who it doesn't match what they can get is silly. So that's kind of the COVID thing. Anything else I need to say about COVID? Let's talk about long haul. We're seeing lots of people with long haul syndrome. There is a whole bunch of stuff to do, and it's all focused on cellular therapy. So we have cells. Cells make organs or systems in our body that turn into the whole body. And so the damage from COVID is on a cellular or molecular level. So you really have to start thinking cellular or molecular interventions. And so there's a lot of things to do. There's some interesting stuff out on ozone. There's interesting stuff potentially with stem cell derivatives. I think umbilical cord tissue. What am I supposed to call it again?
Human cellular tissue products.
Human cellular tissue products that were formerly known as placental mesenchymal stem cells, from term healthy placentas. But there's some ongoing studies on that. We're going to roll out a study on pulmonary fibrosis in the next, for post-COVID patients. So if you know anyone who has pulmonary fibrosis following COVID, please feel free to refer them to Optimal Health Associates, and we'll be having a study, phase 2 trial, FDA approved for that. We will be rolling out a long-haul COVID study for any long-haul related symptoms in the next few months, hopefully the pulmonary fibrosis study in the next month. So we're happy to potentially see people for that. We'll take your name down and then call you once the study opens for both of them. But don't call for long haul yet because we're not there. But just pulmonary post-COVID pulmonary fibrosis. So again, that study's going to be a phase 2 trial using human cellular tissue products, formerly known as mesenchymal stem cell derivatives. But blah, blah, blah. So anyway, he used those in the practice for a variety of things, but now we're having some FDA approved trials finally on this stuff and phase 2 because the phase 1 gave great results. So we'll just see what happens with phase 2. Very safe, boring stuff. There's also some interesting things with ozone for that. There's interesting things with nutrition. There's interesting things with potentially nicotinamide acid. Whole bunch of stuff for long haul you can look at to see if we can do some regeneration of things. The other thing is a lot of these people who we see who still have inflammation in their lungs, no one's addressed the inflammation itself and the root cause. So just basic medical stuff for those people, Symbicort, Pulmicort all the time, and then we think about Singular. Again, these are FDA approved drugs being used for pulmonary stuff, and these are pulmonary problems. So again, well within the center lane of reports. That's really about it. I mean, I think COVID is coming to an end for now. We'll see what happens. I'm not even vaguely concerned about COVID other than the line and stuff. That's the biggest issue. Some little sidebar notes. We know that when the Biden administration was saying they were following science, all this data is coming out now that they weren't following science. They were following the direction of the National Teacher Education Association Union and giving them political cover. That's you just search the net, you can find it. Fauci sent information to Walensky, the head of the CDC, saying there wasn't data to support a lot of this stuff, which he did to cover himself, but said we needed to give political cover to the National Teachers Union. They knew that a lot of the stuff they were doing was completely ineffective and erroneous, and now it's all coming out how damaging it was to the children, and especially minority and poor children, the group that needed the most help. And some political parties say they're for, but really who knows. And they've destroyed the educational process for those kids, and they knew it the whole time that it was meaningless, but they did it anyway. The CDC still will not release lots and lots of data because they don't think we can handle it or be on it or understand it about the effectiveness of the vaccine in certain groups. That's a bummer. But again, I'm for the vaccine for the right people. Again, that's not an issue. I still think it was a great idea for me. I think it was a great idea for anyone middle age or older. But again, I'm not criticizing people who got it younger. It's just, again, as the data comes out, maybe we should have thought about it more.
I do have a couple of questions.
Sure, go ahead.
Somebody is asking they have to get a vaccine and they haven't been vaccinated and they have to get one for travel. What do you think is the best one with the least side effects?
Well,
or would it be more what can you do to negate the side effects?
I think it's negating the side effects, which again goes against the FDA guidelines, but again, the FDA guidelines are idiotic. You do Zyrtec for a few days before, start a baby aspirin. If you're not allergic to this stuff, a few days before, and stay on it for a week or so after. I think that's what we've done. That's what I've always encouraged everyone to do. So that will decrease the risk for the Kunis reaction and decrease the risk for thrombosis. But there's just going to be some mild risks for you if you get the vaccine. But I think they're mild and they're manageable for most people. You basically have to if you get the J&J, a lot of the foreign countries require you to have a booster if you had the J&J. So if you have had at least the 2 Pfizers or the 2 Modernas, you don't have to do the booster. It's a difficult situation for travel.
I'm too late on the other one. Somebody was traveling to London and they were asking about the new variant in the UK, but that's already kind of old news.
Well, the Omicron variant doesn't matter if you've already gotten Omicron or Delta. You still have a chance of getting it if you got original or if you haven't gotten Omicron or Delta with the vaccine, because the vaccine doesn't cover Omicron that well. That's why everyone got it. I mean, we saw more people that were vaccinated But again, in our population, more of our patients are vaccinated than unvaccinated. But it was, I mean, I don't know, 3 or 4 to 1 comparatively. But again, it's just tough subjects. And then finally, a big shout out, thank you to the entire medical team for Gideon. You know who you are. Thanks, all the friends, family, other supporters, patients, everyone who's supported us during our big medical crisis. Can't say enough thank you for that, and it's been very meaningful for Kim and I. The prayers have worked. Gideon went back to school this last week finally, which was really kind of a miracle because it's only 5. It was his 6th week after his injury, and he's making a little progress, and we're very excited. But big shout out to everyone who supported us, and we can never repay you, so thank you. But it really was helpful because our fingers were on the windowsill many times, and it was terrible. But it was everyone's love and support that mattered, and we got great medical care in Colorado and great medical care here. All the orthopods in my group who helped. Okay, I'll have to say their names: Brett Brawley, Ryan Nelson, Ashley Coger, or just have been unbelievable. I know I'm missing people, and then obviously Barbara Mendino at Neuroscience, and then big shout out to him and those people for doing a roundtable about Gideon, and again Brett Brawley, spinal surgeon at our group, sending films out across the United States and getting opinions, trying to get the best plan going, plus all the other people who helped, and all my friends who are doctors, and Carl Orskowski, Bill Bondurant, Cody Aldridge. I mean, so many doctors and friends have helped us, so it makes me humble and makes me want to strive to be even better at medicine than I have been, and try to overachieve for all my patients more. So thank you. Bye.